After the police killings of Eric Garner, Philando Castille, George Floyd, and many others, protest and public outrage forced police departments to re-examine their use of force. Many chose to rely more on what they call less lethal force. But as journalists from Frontline and the Associated Press found over a 3-year investigation, those tactics are still connected to hundreds of deaths.
From 2012 through 2021. They found 1,036 deaths that involved police using some kind of less lethal force.
These are still rare, but it happens more often than the public knows about.
Their investigation is the focus of this new Frontline film documenting police use of force. Director Serginho Roosblad joins me now on this. Thank you so much for being on the show.
Thank you very much for having me.
This is such a emotional topic, I imagine, for families and for folks who watch the events of, really the summer of 2020 and before that unfold. Talk to me about this investigation and also how you were able to create a through line when there were so many nuanced issues to connect.
Yeah, so the film follows the work of 5 reporters out of dozens more that looked at what police call less lethal force. And so this could be any force beyond handcuffs. So they could be taking someone down. It could be tasing someone. It could even be someone being sedated. And the Associated Press looked at the period from 2012 to 2021 to see how many people die in interactions with law enforcement after they've used what's called less lethal force. And so the film looks at 4 different cases that all have elements of these. So when you look at them separately, and that's all throughout this investigation, each incident stands on itself. But once you put them all together, you start seeing patterns. And so one of the true lines through this film is the pattern that, well, first of all, they're all men. The majority of the people in the database are men, 97%. And the second is many were on the intersections of stimulant drug use and or having some sort of mental illness a problem at that moment. So when do we find that these tactics start becoming more widely used? Is it around that 2020 mark? Had it already been in the toolbox but hadn't been used as much as a gun or a billy club in some departments? Yeah, some of these tactics have been really old, and some of them are a little bit newer, like the use of a taser. That is definitely prior to 2020. I think it was earlier in the 2010s that many police departments started adopting the use of a taser. But one of the other uses of force, one of the other tactics that police officers have in their toolbox, which is prone restraint, is really old, and it's basically putting someone on their stomach face down in order to handcuff them and in order to have control over them. And it's also been known for by now decades that it could be problematic to certain people, whether or not they are obese or they have like certain types of drugs into their system, and or if you leave them on their stomach for too long, that could be a problem as well. Like one of the cases that we found in this investigation, a person was left on their stomach in a prone restraint for 22 minutes. But in 1995 already, the Department of Justice put out a bulletin saying that prone restraint could be dangerous and that officers should, once they've handcuffed someone, should roll them over into the recovery or sometimes called rescue position, which means roll them over on their side so that they can continue to properly breathe, and not leave them in the prone position for a prolonged amount of time. And, to that point, we actually have a piece of sound from Justin Pritchard with the AP describing the types of force that you all focused on.
We're looking at deaths that don't involve someone being shot and killed, deaths after interactions that involve at least a certain level of force that's beyond handcuffing. Less lethal force can be a range of things, and it doesn't always have to be excessive use of these things, like a taser, a baton. It can be physical force, punching, taking someone down. It can be when they're down, they're in prone position with a knee on their back, forced sedation.
Lots of types of this so-called less lethal force, but I'm also thoughtful about this topic of excited delirium, which ends up being a very common reason that police officers employ when they find themselves sort of on the other side of the law or being questioned about their use of force. So talk to me about that and sort of how prolific it ends up being in these cases.
Yeah, so excited delirium, as we were making this film and we asked various experts on, like, what is excited delirium? Can you describe it? They always had like somewhat of a difficulty to explain it, but in short, it's a term that's used to describe a potentially life-threatening state of agitation. Sometimes it's induced by drugs, but by now it's become widely discredited by the medical establishment. And so what you had with excited delirium is that quite often medical examiners cited it as a cause of death. When after someone was, showing these signs and eventually dying. But what we found in our investigation and what some others have found as well is that excited delirium seems to be somewhat exclusively used only after someone died in an interaction with police officers. So it's what some experts say, shifting the blame from the potential use of force from the officers to the victim. It's their fault. They have had something, going on in their body. They got way too agitated and their body couldn't handle it and therefore they died. But as we've looked at some of the cases in our database that have been described as, or the medical examiner cited excited delirium, a closer look together with some experts revealed that quite often the use of force from police officers played a much bigger role than the person's medical state or their state of,
Yeah, we mentioned drugs there. One tactic of less lethal force is sedation by ketamine or Versed. The research that the AP conducted found a pattern where 1 in every 10 people in the database had been sedated, and shortly afterward, they suffer cardiac arrest and respiratory arrest and die, as you mentioned here. We also have a piece of sound or a piece from the documentary here where an EMS educator and paramedic, his name is Eric Garner, discussed how it is used in the field and why he has some real concerns here.
I think ketamine used properly is a very safe and effective drug. I think that the way we rolled it out to the EMS community without a proper understanding of the risks involved and how to mitigate those risks created the risk of harm.
Among those risks are how the sedatives can interact with drugs or alcohol already in someone's system, and how they can further restrict breathing of someone already being restrained and in distress.
There was a fair number of times where individuals were chemically sedated where, with the understanding we now have, we would elect not to perform that chemical sedation.
So talk to me more about this particular less lethal sort of use of Versed here.
Yeah, so we were just talking about excited delirium. Back in 2009, the American College of Emergency Physicians were one of the medical organizations who said, yes, actually, excited delirium is a real condition, and one of the ways to treat it is by sedating people out in the field. And so paramedics, it's not police who are sedating people, but they're doing it. The paramedics are doing that. Paramedics started using a sedation out in the field, and according to the experts, quite often it works fine. Someone calms down or either kind of falls asleep and wakes up in the hospital and is able to get help, but it's not when paramedics arrive and police officers arrive on what sometimes is a very chaotic scene, they do not know what kind of medical condition this person might have, what kind of drugs or alcohol they have in their system. So they try to control the situation as soon as possible and sedate a person, not knowing what other interactions the sedation might have, and the person ends up losing consciousness and then eventually die.
I'm also thoughtful of what does this mean to you personally? I know I felt emotional in watching this as well. What does this mean to you personally to have put together this film, to directed this particular documentary? And also, what do you see as the clear call to action here?
Sure, yeah. So a lot of the things in this documentary, a lot of the topics that we uncovered were also pretty new to me. I did not know that in some of these interactions, people were sedated, for example. I had heard, obviously, of George Floyd's last words, I can't breathe, and Eric Garner before him. And maybe there might have been another case out there as well. But this investigation has yielded so much body camera footage that they could, you can put it all together and you can start seeing patterns. And one of the patterns that really surprised me was that the amount of times that people said, I can't breathe, that this was said, at least captured. We don't know if, it was said even more times by people where it wasn't captured by body camera or not written down by police officers in their report afterwards. So that was something that really struck me. But the one thing that I do feel like that is kind of like the call to action, so to say, is hopefully that people don't see it necessarily as an anti-police film, that is not a film to criticize police, but it's a film really about human interactions and human interactions gone wrong. And I think there might be a lot of lessons here that we can all learn, whether it's like how do we deal with people dealing with a mental health crisis out on the street, to how do law enforcement officers deal with someone once they've handcuffed them, and should they roll them over immediately? Like, how is it that this message that was sent out there since the 1990s has not permeated to all police departments across the country, that there is like a way that police officers approach these techniques uniformly across the United States?
Serginho Roosblad, thank you so much. I appreciate it.